symptoms, and it's just really a common cold for them. So most kids do very well. It seems like young kids especially are less likely to have symptoms. So children less than 10 especially less likely to have symptoms. And what we know so far is that those young kids seem less likely to spread the virus to others if they do have an infection. Older children, there's mixed data on how much they're spreading it. It seems that older children may spread more like adults, and especially young adults, college students, the data we have in that age group is that it does seem like they contribute to the spread of the virus. So there's been several studies that look at our schools, in-person schools, a place where COVID is spread. So I'm going to talk briefly about those. I will say that it is a moving target, and so these studies are looking at the pandemic as we go along. Most schools where there was in-person school also had an option to be at home, and so schools were not at full capacity. The several studies, especially more recent studies, have shown that overall schools are a lower risk setting for COVID. There's not a zero risk chance of getting COVID, but there's a very small amount of spread within schools, and it actually seems like less spread than in the community. So several studies have looked at that, including a study in North Carolina where they used contact tracers from the health departments to look at where kids were getting COVID. And there were several hundred cases of COVID, most of which had been in the community, and only 32 infections from in school and no spread from children to teachers. So that was a study here in North Carolina looking at schools and COVID. So that's a summary of kind of what we know now about COVID, how it spread, and then a little bit about what we know so far about COVID and schools.
Katie, you talked about some of the precautions that we ought to be taking. There is a question in the chat about specific elements in terms of the return to school safety precautions that the schools may or may not be taking. Is there something parents should be looking for? Is there something teachers should be looking for?
Yeah, in terms of what precautions the schools are taking. Yeah, so I think the American Academy of Pediatrics released guidelines helping to guide schools as they go back. And there's a little bit of variation in their recommendation based on age. So overall, we recommend those 3 W's. So wearing masks, that should definitely be a big component of safety in schools for all children over the age of 2. That has been one of the biggest things that helping to prevent spread of COVID. Wearing masks, distancing can depend a little bit on the age and how logistically schools can do that. And so ideally, they recommend that kids are 6 feet apart, but between 3 to 6 feet is okay. And for younger kids, distancing can be really hard because they don't understand that as well. And the recommendations are that in that age group, especially those younger kids, that's not as important because they're less likely to spread it, but still wearing masks. And then hand washing. Many schools, and in the recommendations, this is a positive but not a required, is recommended to cohort the students so they stay in the same groups and aren't mixing among a lot of different students.
Another question in the chat relates to airborne transmission versus droplet transmission, and what we know about the data regarding both of those modes of transmission, and how our classrooms and our schools, the physical environment of those classrooms, is it adequate for appropriate ventilation, for appropriate distancing? What are our thoughts on that question?
Yeah, I can answer that also, and then if others want to chime in, they can. But I think primarily, so mostly coronavirus or COVID is spread by droplets, which if you think about a sneeze, little pieces of water come out of your mouth, there's saliva come out of your mouth, and those contain little parts of the virus. And so primarily that is how the virus is spread. There is thought to be some airborne transmission as a component of that virus, and those would be tiny little bits of virus that stay in the air. Having a person who's infected be, let's say they're in a classroom talking without a mask, there will likely be some droplets coming out and maybe some airborne droplets as well. If the person who has that infection has a mask over their mouth, they're much less likely to release those droplets into the air and kind of generalized into the air. We know that having some air circulation within a closed-in space can decrease the likelihood of spread. And so we recommend, if it's okay weather-wise, opening a window, having fans circulate the air, having air filters that are circulating air and filtering out particles. All of those can help decrease the spread of COVID. I think it's a very difficult situation to be a politician right now, but we hope that as those politicians are making decisions about sending kids back to school, they are also providing support financially to the schools to do some of these things that might be more expensive, such as increasing that air circulation and filtration.
So in terms of, bringing some other perspectives and voices into the conversation, we have, I think, several teachers in the attendee group today, and they're hearing Dr. Jordan talk about some of the medical facts, the medical realities, but there are some comments about anxiety, about feeling, potentially still unsafe as kids are being, in some communities, let back into the schools, either on a full-time or a part-time basis. Teachers, faculty in the schools, administrative staff worried, what is their real world risk of exposure? How likely is it for them to get sick, and should they be concerned? I'd love to get the panelists' thoughts on this very important issue.
Yeah, and I read a lot about the studies, and so I'm happy to talk some about that too. And you guys also please chime in if you've read other studies too. But I think that is a very legitimate concern. And so we know, I think one study that looked at teachers and staff in schools, that maybe about 50% are at higher risk for complications from COVID. And so I talked earlier that children are typically at very low risk. The faculty and staff, that may not be the case. And so I understand that anxiety, and that may, for family members of kids, they may also have those risk factors. I think wearing masks can definitely help decrease that spread. Even if you're in the same room as somebody with COVID, having your own mask and having that person have a mask decreases your risk. N95 mask can decrease that risk even more if you're wearing an N95 mask that helps protect against those airborne particles that we talked about. I know this isn't, we could do a whole webinar on the COVID-19 vaccine, but that's also a really exciting thing that's happening now and really decreasing your risk of contracting COVID and having serious effects from COVID. Teachers should be in that next group to get the vaccine, the group including essential workers.
As teachers may be anxious about the return, obviously parents will be anxious and children may be anxious as well. Thinking about the potential emotional, psychological impact on these kids and on their parents as they're heading back, I'd like to hear some reflections on that issue, where the landmines are and what we could do to strategize to help these kids and their parents.
I can talk a little bit about that. And, I think one of the main things that we're having to kind of navigate with all of this is sort of just how quickly things change. And I kind of want to just reinforce what Dr. Jordan said about how I want to acknowledge how difficult this is for everybody, for our kids, for the parents, for the teachers, for staff, for student support professionals, and sort of just the wide range of experiences and needs that are out there when we talk about this. And so thinking about preparing for these transitions, I think one of the first things that we need to do when we talk to our kids is just sort of preparing them for the uncertainty, and knowing and being honest about what we know in terms of protecting ourselves against COVID-19 and the risk, and also that things are going to continue to change for a little bit. So focusing a little bit on preparing our kids for what's in their control, um, strategies for staying safe, strategies for washing hands, how to wear a mask properly, how to have those conversations with kids in school at any age, from kindergarten to college. If you feel like your boundaries are being crossed physically. So when we talk to kids, kids are so resilient and so amazing. I think, at least in my role as a parent and sort of watching my own kids, I oftentimes sort of have to check my own assumptions about what I think they can handle and what I think I need to control for them. And oftentimes they're the most benefit seeking, flexible, open minded. And I have to sort of stop myself from projecting my own fears onto them, and then listening to my own kids and hearing what their needs are and kind of working through that.
Yeah, I mean, I think the idea of what is protective for kids around, not physically protective. I think Dr. Dorn has spoken a lot about the precautions at schools. I think one of the things that we've seen and looking at some of the literature around kids' experience as well as parents of the pandemic, the uncertainty is one of the biggest challenges for all of us. And so the idea of how do you have routine when you're at home, and especially if you have a kid who is home 2 days and at school 2 days and they have a asynchronous day, like really, what does it mean to have some kind of a routine when every day is sort of broken up in that way? And I think that's where, certainly things that I've thought about and I've recommended to parents is really using the things that you do have control over. What happens in the evening might be that one thing that you can control. So having the evening time have a certain routine that's the same, whether it's a school day at school or an asynchronous day. But trying to think about what are those rituals and routines that you can give kids, across all ages, that sort of ground them that this is another day. Is there something about preparing, setting out your clothes for the next day, whether it's for going to school or staying home, and maybe when you have a different set of clothes you wear when you're home versus, but there are little routines that you can, I think, use to help kids have a sense of like, this is a pattern. And again, in a time where we all have so much uncertainty, those small things can be helpful. And maybe is something they take from home, a pencil they use at school and at home, maybe something that they can bring back and forth. But I think to the degree there's so much out of control that if you can, again, sort of what Dr. Marancini was saying, like, how do you help these kids who are flexible cope? And then for kids who are less flexible, it really being thoughtful about what they need to be able to frame shift between these different things. Children with special healthcare needs who have learning disabilities or have ADHD or who have diabetes or a different medical condition, what do they need to be able to do to move between these different modes? And it may be actually, that may take a lot more preparation and working with the school around IEPs and other things like that. So it's to me, it's that idea of individualizing and getting down to, like, what are things that are concrete that you can do to help things be familiar.
Gary, one of the points you raised, which I think is important, is that we do have children that we take care of, all of us that have medical complexity, that have chronic illnesses. And I can tell you from a specialist perspective, we're still struggling in my field with being able to answer all the questions that are coming from our families about their children with heart disease and what is safe and what is not safe. Data seems to be, coming out on almost a daily basis. Variety of professional organizations have given recommendations, and I think we're all doing our best. We're all drinking from a fire hose, doing our best to try to sort through that information and figure it out. I think that it's a difficult situation for parents and children to be in. It's also, I think, been challenging for us as providers to be able to give cogent, pertinent, and up-to-date information. So with these children with illness, whether it's diabetes or asthma or heart conditions, are there any specific strategies that any of you recommend, whether it's finding a mask that fits properly, or educating a child about social distancing? It could be very hard depending on the age and the developmental stage of the child. Any thoughts about specific tactics that we can advise patients and their families around?
And I think one thing, I think this has come in the question, but the specifics of what the school district and the school is doing matter. And so if you are in a situation where the school has has the ventilation, has has space, and that makes a big difference. There's, I think, a study, was it from Wisconsin, with like 17 schools and but a fairly low number of kids in the classes. So if you have 10 kids in a class, that's very different, because that pod may be very different than a class that has 20 or 25. And so I guess the first question is kind of, what is the school's plan? And then recognizing within that how you might work with the child. Certainly if the kid is, if a school can have smaller class sizes, and again, that's part of the resource question, is there enough resources to have enough support that you can have smaller class sizes? Then you, I think, can do more to help that child, be able to be in an environment where they can, keep learning and being connected. If you have a larger class, is there a teacher's assistant or someone? I think the key thing to me is, regardless of the age, who is the person they're going to go talk to and be able to seek help from and reassurance? Is that a teacher, a teacher's assistant? And then if they do have to, if they have trouble wearing a mask, and most kids I think are pretty comfortable wearing masks. We have like 4 and 5-year-olds who come into clinic and are great at it. And then you have older kids who have trouble. So I don't know if that gets to your question, Angela, but I think the idea of, to me, it is understanding what the setting is, and then really talking with your child about, this is what it's going to be like. You're going to be in a group, and it's going to have 5 other kids or 10 other kids or 15 other kids, and you're going to sit in this spot, and this is how it's going to work, and this is how, like, in many ways, especially kids with special needs, that almost like a social story of, this is what's going to happen, and this is so that they know what to expect. I think can be really helpful. And certainly talking to families that have gone back, it looks very different. And I think just helping kids be comfortable with that. So I don't know if you all have other comments.
I would just echo that, and also say that all of this could extend to kids with neurodiversity as well. And so when we think about sort of the levels of flexibility and kind of need for routine, you and we as parents sort of know our kids best. So finding that motivation for your particular kid and knowing sort of the limitations of what they're kind of willing to be flexible around will really help you problem solve. And I guess the other thing I would say is definitely collaborate with your school around these issues. So if you are connected to a particular individual, be it the teacher, a teaching assistant, one of your support professionals in the school, like loop them into some of these concerns, because I know, in the interviews and surveys that we've been doing with student professionals across the state of North Carolina, that they really want to help your kids and figure out how to make this the best scenario for everyone. So be afraid to use your tool as a resource.
There was a comment that came up regarding control. I think it's an issue that we all struggle with as healthcare providers. Patients often feel completely at the mercy of forces that they can't control. I think the pandemic is a great example of an environment where many people feel that way, whether it's from a medical perspective or a psychological perspective, a financial perspective, et cetera, and so on. As pediatric providers and as people who are trained to support the needs of children, how do we strategize around giving children some voice in this process, some modicum of control, some ability to influence their situation when there are all these extraneous forces at play that seem insurmountable.
I can talk a little bit about that. You know, I think it can be as small as, you know, so everyone who's watching, like, I don't know, some of your kids may already be in person, some are in hybrid format, some are in virtual. And so, you know, it depends on your scenario, but if you're the one who's working with your child virtually, it can be as small as choice in the assignment that your child's going to work on next. And in thinking through meal planning. And I mean, I think one of the concrete strategies that I would recommend for families with children with IEPs or 504s who are trying to figure out how to navigate balancing that, which I know has been, I've heard from many folks, has been really, really challenging, is thinking through how you can collaborate with your child around what that IEP plan and what those learning goals look like in your home setting. And so, I mean, this is sort of tangenting a little bit, but just thinking through like some of the daily activities that your child might be interested in and working with them to think about how that might meet some of their other learning goals, whether it's cooking or whether it's art or different things that you might be kind of tackling day to day. I think combined with that, sort of being willing to acknowledge that we have control over some things and we can focus on the things that we can control over. And then there's other things that we have to anticipate that we can't control.
One of the issues that's come up in the popular press, and I think families are dealing with, you know, in terms of children who have mental illness, mood disorders, learning disabilities, associated problems, seems to be yet another incredible challenge in this environment, both from an educational perspective and from a general health perspective. What are we seeing on the front lines in terms of the real impacts, specifically for children who may have a predisposition to mood disorder? You know, there's been some talk in the press about the change in suicide ideation, suicide rates. What is the latest information, and what can we discuss today that may be helpful for families?
Yeah, so I'd love to talk a little bit about that. I think when we look at the effects of COVID, and when we specifically look at the effects of virtual and remote services and sort of school displacement, we have to think about two different types of research. And so I'm going to directly talk about suicide in a second, but one is what we think might happen, how we're using previous data and underlying risk factors that we're aware of to sort of anticipate the challenges to come and influence policy and influence decisions around what schools should and shouldn't be doing to sort of mitigate many of those risks. And then the other is what we know to actually be happening. And these are sort of raw data, live time, real results of what people are saying is happening to them. And when we talk about mental health, what we're seeing right now is evidence that there's higher levels of distress, and we're seeing some sort of emerging patterns around specific symptoms related to mental health conditions. But we don't yet really have concrete evidence that rates of suicidal ideation and suicide attempts have increased. And so I want to just kind of back up and say that there's lots of concern, myself included, for the potential for risk for suicide to go up. And that especially early in the pandemic, we've been seeing all sorts of reports about how being away from school takes kids away from their social connections. Schools are a wonderful place where kids can access comprehensive suicide prevention. They get connections to care, they get kind of more universal interventions, but they also get these direct referrals when they're in crisis. And there's no reason that has to stop in the circumstance of remote learning. And in fact, I can tell you that, you know, having done this research with school professionals, that schools are being really creative and thinking through how they can continue to do this. But recently, like especially in the last few months, there's been just what you were saying, really increased attention in the media around suicide with really heart-wrenching stories of loss. And it's really hard to read. And right now, what's really important to know is that suicide is preventable. We have evidence-based treatments for individuals and kids who are experiencing suicidal ideation. And we need to keep focusing on connecting kids to care. We know that just as many of the wonderful things that schools house that can protect kids against suicide, there's also risk factors for other kids in schools, like bullying or facing daily microaggressions, or academic stressors. And so suicide risk and what leads individuals towards suicide is diverse. There's multiple pathways. There's no one thing that leads someone to take their life by suicide. And it doesn't suddenly occur. It is strongly linked to underlying mental health conditions. And now more than ever, we want to remain vigilant and, really reach out to our kids and connect with them and make sure they're connected socially. But we don't want to conflate social distancing and physical distancing. So we can remain physically distanced, but continue to engage in these social connections. And when we read the rates that we know about right now, they don't yet have any evidence that suicide has gone up. There have been a couple studies that have come out recently that suggest that there's an increased proportion of treatment seeking, specifically for mental health concerns in kids. So specifically that kids are going to the emergency department for risk related to suicide or risk related to mental health crises. But these studies are suggesting that the proportions have been higher this year, but the rates haven't necessarily changed. So we're seeing that overall emergency department visits are dropping for other things, but they're remaining relatively stable for mental health crises. And this is actually not a bad thing. This is a good thing. We want to be connecting kids to care by multiple avenues, not just emergency department visits. So I guess kind of the thing that I want to say is that we absolutely have to take this seriously and remain vigilant and focus on suicide prevention, absolutely. But it's also not a foregone conclusion that rates are increasing, nor that specifically school hybrid approaches or remote approaches are linked to that. It's far more complex.
I think that's a great point in terms of the fact that there has not been documentation of increased suicide rates in kids or adults, and utilization around like people coming for emergencies is stable. There are studies looking at the rates of symptoms being greater, so more people, kids and adults, reporting depressive symptoms, more kids and adults reporting anxiety symptoms. And so in some ways, I think one of the things that I think about around just general health is how do parents take care of themselves, and that actually may be the most important thing for child mental health. And again, that's very, very hard during this time. But the in general, not putting suicide to the side, but putting, again, kids' mental health in general, parents being able to be present and connected with their kids is really the most important thing. Like, all of us can do so much for our kids by being present, and I find myself getting distracted, getting overwhelmed, or having too many Zoom meetings, or being interrupted during Zoom, and being short with my kids. And I recognize, like, what can I do differently to take care of myself so that I can be present to support them through what they're going through. And I think that idea of there's so much that's out of our control right now. The question of how do you find 10 minutes of positive time with a child makes a big difference. And for younger kids, there's something called child-directed activity or child-directed play, where if you can just sit with them and be present with them and let them do whatever they want, whether that's playing with Legos or telling you what to do with a doll, that's certainly the most important. That idea, I think, is really, really powerful. So there are things you can do to help kids that aren't necessarily even involving accessing or seeking mental health care for them. But just again, the things that very hard to do given the challenges of this time. Like, how do you take care of yourself, or get enough exercise, or get enough sleep, or eat healthy, or do any of the things you need to when it's such a stressful time. But it is one thing that I think can help children if you are thinking about it.
Yeah, I just want to jump right back in and reinforce that at the core level, focusing on sort of those four main things, which are like good, healthy sleep habits, good, healthy hygiene, like eating a balanced diet, getting exercise, and then taking time to connect with others. Like, if we can just that as our priority to be monitoring for ourselves and for our kids, that could really go a long way. And I agree, it's like so much easier said than done. And, a study came out recently that suggests that for parents in particular with kids with mental and chronic mental health conditions and chronic health conditions, that they're having higher levels of symptoms, depressive symptoms and anxiety symptoms. And so taking all of this and approaching it as a parent and knowing that this is really hard and being kind to ourselves is also kind of the best modeling that we can do in those moments when we're short with our kids. And we immediately recognize that instead of sort of just ignoring it, modeling how to calm down and work through that is some of the best kind of ways that we can teach kids how to use these coping strategies that we're trying to teach ourselves simultaneously, right?
And jumping off of that with social connection in a pandemic is really difficult. And I think it's difficult for parents and also for kids. And I think parents worry about that too, and worry about their kids getting social connection. Based on what the studies that we have and what we know about spread of COVID, overall, the risk of spread outdoors, especially if you're wearing a mask, is low. And so I think depending on individual situations, I think it's very reasonable to have kids see their friends outside with masks, to have you see your friends outside with masks, and have some of that social connection that will help rejuvenate you and your children, especially during with those parents who are doing distance learning and kids who are struggling doing distance learning and missing their friends.
A question for the panelists today. Development is impacted so significantly by education, and we're now taking children of all age at various educational levels, and we're subjecting them to new ways of learning. And in many cases, it may not be working for these children. What are the risks? Are we risking significant behavioral and developmental issues? Are we risking significant delays in the proper sequencing of education and transitions that kids should be making, say from elementary education to secondary education? What are your thoughts in that regard?
And I can talk a little bit about what we know about, or what we don't know in a bit about the effects of sort of this shift that we've experienced. And it's not similar to what I was saying before, which is a lot of what we think is happening is based on kind of models that have taken previous data that's similar and tried to figure out what we think is going to happen. And so using things like times of summer when learning isn't happening, and using times when other natural disasters have happened, and some of the data from earlier on in the pandemic. And I think, again, we're still not in the full kind of answers just yet, but those models do suggest that there may be some negative learning outcomes the way that we traditionally measure them in terms of like reading and math, and that they'll be particularly difficult for our most vulnerable kids. So kids who were already struggling academically, kids who may have access to less resources by way of their family, by way of their community, by way of the whole school. And so my hope, is that that this is an iterative learning process, that we're sort of engaging in these processes to monitor this. And I didn't quite get to the developmental transitions. There's so much loss that I think we need to process with our kids, and also so much of what's so different for what we expected. Like, this is not what I expected my second graders year to be like, rolling out of bed and putting her on the couch and plugging her into a computer, and we're making the best of it. But there's definitely a piece of loss with that. Simultaneous to that, though, I would say there are opportunities to see sort of the unanticipated benefits. And, I'll give you a really concrete example. And I know that this is just one idea, but kids who may have been shy in the classroom might be a little bit more outgoing now. So there's little pockets of things to kind of pay attention to that might be unexpected and shift the way we think about some of these milestones. But I think absolutely there's this sense of loss too.
I think variability, again, I guess I didn't realize that was going to be my theme, but I think there are some kids, like I have patients who this has been their best year academically. They've been really happy and comfortable and learning in this kind of environment. And then there are other kids who this has been really traumatic and really difficult, and they've not been able to thrive at all. I think one thing that may come out of this is there may be ways in which we're able to more directly tie learning styles to modes. And so there might be kids for whom virtual stuff can be used for certain things, and that might be really positive. But there are kids, I think this is where I hope that schools, through their IEP process or through other processes, really can evaluate where kids are and then target the learning, the catch up or the other things. Also, certainly the equity perspective, there are communities where there's huge access issues with say, broadband or access to computers. And for those kids, having no access is certainly, a major problem that we're going to be catching up with. On the flip side, just in general, kids have learned a lot this year from their parents, from all these experiences that is maybe different, but it also is really relevant to say some of the skills they probably learned are relevant for the 21st century economy, and they may actually be more ahead and prepared in other ways. So I think we're going to spend a lot of time trying to parse out who benefited, who was harmed by this. But at the school level, at the classroom level, at the student level, really digging into like each individual person, what are they going to need to catch up on, I think is going to be a priority. So.
Yeah, and I mean, I think variability really is the theme. I agree. And I think one thing that I will say that we're lucky in North Carolina is that prior to COVID-19, schools had really started rolling out multi-tiered systems of supports, which are these frameworks for identifying where kids are falling behind regularly. So screening for this and tying specific interventions to help support kids to make those gains and then monitoring that progress. And so there's no reason that that isn't perfectly applied to this scenario. And what's, I think, really wonderful about the fact that we've luckily started this prior to the pandemic is that it doesn't really make the assumption that any one curriculum fits the needs of all kids, so that it expects and anticipates that kids are going to need additional supports in different areas. And so if we can continue to kind of capitalize on that, and as parents, if you are curious, this is something you can reach out to your teacher about and find out, is my child receiving any services? They tier them like, is their child receiving any services under this tiered system of support? And then you can kind of see how you can monitor their progress in week to week or day to day.
In this final section of today's conversation, I want to get to some of the questions that have come up from the attendees. Thank goodness they're not asking any tough questions. So let's dive right in. One of the questions that's come up from a few attendees is, they're hearing about these virus variants in different parts of the world, places like South Africa, places like the United Kingdom, and now here in the United States. Do we have any intelligence on the impact of these variants, whether it's related to the effectiveness of immunization or how it might impact our kids heading back to school or not?
That's a great question, and I can answer part of that based on what we know. I think it seems like some of these variants are more contagious and spreading easier, which may affect, although I don't know for sure, but may affect going back to school, in that if we see another surge, some places may want to delay going back to in-person school. To my knowledge, we don't have data yet about these variants in children and their spread in children. But overall, population-wide, seems like they are more contagious. Vaccines may be somewhat less effective against the variant that was first identified in South Africa, but those vaccines do still seem to be effective at preventing severe illness and death in those variants. And so I think thinking about that as a healthcare worker and somebody who is also coming into contact with COVID, I think I feel that fear too, is that unknown, but also saying, getting a common, if I have contract COVID from a variant and I have a common cold symptom or syndrome, that's okay. We're really interested in preventing the severe illness, those hospitalizations and the deaths, significant illnesses from COVID. So it does seem like the vaccines are still doing their job in that respect. That's a great question. And we will continue to learn more too. And there may be more variants. That's what viruses do, is change. They're replicating and changing their genetics quickly. And that was expected. And I think the vaccine makers are anticipating that and planning to make boosters kind of like we get for the flu shot, that's changing every year, multiple different strains of flu every year. So it can be scary, but it's also expected.
There are several questions related to the guidance around the 6-foot distance for separation, which, depending on whom you read, is either a recommendation or a requirement, which has implications, right? And there is potentially this pressure to get kids caught back up from an educational perspective. But what if we can't maintain 6 feet in classrooms? So how confident do we feel about that recommendation or requirement? And, what is the impact if we can't achieve it?
So this is a hard question, and you guys are asking great questions. I think, like all of this, it's such a balance and such a discussion between this, are we harming kids with keeping them away, or is it better for them to come back? What is the risk for the teachers and staff and parents who might have higher risk if they do contract COVID? So it's all a balance. And I think with each decision we're making, it is, how much does this increase the risk of COVID? I think all of us have some risk. If we're leaving our house, we're going to a store or a grocery store. So life right now is not zero risk. And so we're kind of trying to find that happy spot where we're minimizing the risk of getting COVID, but also having some of those benefits of being in person in school. And I don't know how much really we know about that the 6 feet for schools specifically. I think that came from studying the virus and the virus properties, although I do not think it was in children specifically that they studied that. Again, most of these studies, I think Dr. Maslow also talked about this, the studies are done so far in schools where there was a hybrid model, and so not at full capacity. So there was more distancing. I think the best we know is between 3 to 6 feet is ideal. Masking especially, but I don't have a great answer. Dr. Maslow may have a better one, but I can't say for sure that 6 feet is perfect.
Yeah, I mean, I think this is one of those areas where this is, there are a lot of schools that are back in other parts of the country that are following this, and there has not been a lot of school-based transmission. So that's sort of what it's based on. So it's a, there's the Brown group, and they're on CNN a lot. And so you probably could hear them speak about it. If you Google Brown public health and schools and CNN, you probably see their presentations about this, but they're a group that's really been looking at schools that are actually implementing it, and following those guidelines, there has not been a large amount of spread. The challenge with all of this is these are public health approaches, and it's always hard for an individual child to know, in general, this should be protected, but there are people who may get affected. And that's the hardest thing with all of this. I think there was a question about things like asthma or other conditions. I think someone asked about immune suppressants, and if they have a child who has these special needs. And I think that the best I think you can do is try to read about this and make that individual decision. It seems in general with the AAP and all these other guidelines that most kids can be in school safely, if, and it's a big if, the school is taking precautions that I think the governor's office has outlined in North Carolina. asthma in particular, someone asked a question about asthma. I was just looking it up. There are different guidelines about this, and again, I think looking at those guidelines is probably your best bet, and weighing your comfort with risk versus not. And I think to your point, Angelo, for your patients who have heart disease, we don't know for sure, but trying to take balance what your child needs medically versus what they need in terms of educationally is kind of probably the calculation that to do. One other thing I was going to was just thinking about is there's a resource, and I can put it in the chat, or I don't know how we can summarize it, but the National Child Traumatic Stress Network has put out some really nice COVID resources for parents and children that go through all sorts of aspects of these different decisions. And so they have several different kind of handouts for kids, handouts for parents that talk about some of these decisions, but also talk about dealing with the stress of this time. So that's a nice resource I can put in the chat that has a link to that.
Gary, to your point, one strategy we've adopted in my group is we recognize that all children with heart disease are not the same. And we also recognize that it seems that children with stable heart disease are probably at no increased risk, either from contracting COVID or suffering any abnormal or severe consequences from it. However, we are supporting parents in their decisions. So when families have come to us saying, you know what, we are just not comfortable. We have a child who's, several years out from heart surgery, for example, even though the child is doing well, there's something about this that doesn't sit well with us. We're trying to be very supportive of those decisions, to the point where we're actually saying to the family, we will write a letter of support if you decide to keep your child either in a hybrid model or completely at home. And I just agree with you in that it's not a monolithic solution. We really need to look at these cases on an individual basis and use, the data on a case-by-case basis. And this also connects to an issue that we haven't quite addressed head on, but I do want to hear the panel's thoughts on it, because it's so timely and it's so relevant. We all treat patients from a variety of socioeconomic backgrounds, a variety of different contexts of living. And we've all recognized that, the so-called social drivers of health are among the most important factors in determining how we deal with disease, how we overcome disease or not. And I'd just be curious to hear all of your perspectives on this issue of equity in care, and how the social drivers of care are impacting the way children are being impacted by the pandemic.
I can share a little bit about what we're seeing with schools. And I guess first and foremost, I think equity is embedded in everything we've been talking about this whole time. And some of that variability is something that's part of what we need to consider. I mentioned earlier that we're kind of expecting these disproportionate effects for kids who might be more vulnerable in terms of learning outcomes. But you name it, there's a slew of things we can look up and talk about in terms of what we can worry about risk for, from maltreatment to food insecurity, to housing. Like there's so many different ways that we would need to consider it. I read a research paper recently that looked at Indigenous kids in really remote settings that have zero access to internet. And then by comparison, we actually are seeing a small number of school districts that have been able to connect with even their most vulnerable kids because they've faced disruptions like this before and have established really good protocols. So these are primarily districts in Florida and California that have been able to kind of apply best practice and really serve their kids by collaborating with the community, to eliminate some of the technology barriers that we're seeing is sort of a big problem for a lot of our kids. But holding that is probably the exception, not the norm. It does give us sort of hope in terms of where we're headed and what we're looking towards in the future. Also, in terms of, just thinking about the different kind of lenses that we bring to these conversations. I know we haven't talked about what we should do for schools. Like, should they reopen? Should they not? You know, this is a really like hotly debated topic, and it's really complicated. And we've talked about sort of the science around it, and there isn't a clear answer. It's community by community. But some of the early surveys that we've seen that have looked at sort of parents' perspectives on how schooling is the quality of schooling in remote times, and also kind of if parents feel safe in sending their kids back to school. And there's sort of two things that we've seen. We've seen that white parents disproportionately favor feeling that it's safe to return to schools compared to ethnic and racial minoritized parents. Although those are percents and there's a lot of variability in there. And I know we're running out of time, but I want to acknowledge that in some of my work with my colleague Dana Griffin, we've been monitoring a lot of parent boards, and I've really noticed that Black voices are missing from a lot of this conversation. And so I'll acknowledge that I am talking about this from the lens as a white mom in a privileged position with a job that has a lot of flexibility. And so those are just, so I guess when we talk about equity, those are just numbers, and we're seeing the same kind of diversity across all these different experiences and all these different backgrounds as what we've been talking about this whole time, but that we need to acknowledge sort of just this, the lens of privilege that we're having this conversation from.
And I think I would add to that, I think that's exactly the right sentiment, and the financial and economic effects, as well as the effects of different communities that have higher rates of COVID death. Like this affects everyone, and it affects different people differentially. And so I think school, the consequences of kids not being in school, if you have two parents working full time, is different than others. So there's a lot of the financial and economic aspects of this are ones that I think obviously the governmental groups are working on, but ultimately the most vulnerable children are the ones that we're going to have to be the most thoughtful about in terms of how to monitor and check on how they're doing. And so yeah.
And I think Gary touched on this, but COVID has disproportionately affected communities of color, Black and Latino communities. And I think that just highlights we have a lot of work to do for improving equity in general in our country, in our state, in our local community. So both medically and then on the education side, I think it's highlighted disparities that we need to work on.
Yeah, just that inequity was here before COVID, and it remains. And we continue to need culturally sensitive approaches towards problem solving.
Well, I think, it's fair to say that this past year has been one of the most challenging, and also in many respects the most rewarding of my professional career. I think I speak for many of my colleagues that we've seen things we'd never seen before, and we've had to strategize around new ways of providing healthcare, engaging with our patients. And I hope that we are becoming more attuned to these social drivers of care, and it will be a big challenge for us in the future to develop tactics that meaningfully address these issues. But it's going to be incredibly challenging. The pandemic has really shown us where all the fault lines are. So much work to do. I want to conclude by offering a wholehearted thanks to my colleagues and friends on this call. It's been an amazing conversation. I've learned a great deal of new information, and I'm very excited to learn more. I want to thank all the attendees who spent a portion of their day with us. We hope you will join us for future conversations. We plan to have a whole series of these in the upcoming months, so stay tuned. Please follow us on our social media channels, and we hope to be able to engage with you in other ways in the future. Thank you so much. Have a great day. Stay healthy, and please take care, everyone. Thank you.
Thank you all.